Managing Trustee, other Dr. Girija Madam. Today, Dr. Girija Madam, who is practicing in Chennai, have reached here to present a paper on her active intervention in COVID, during COVID period in COVID patients. It is actually a real task that she has accomplished while in Kerala when the COVID situation was worse. Ayurvedic physicians were not allowed to practice COVID treatment in COVID patients, but at that time Tamil Nadu was practicing COVID. So I feel that actually because I've heard about Madam from Dr. Arya Vaidya Sala, who is the head of department of NMR in All India Institute of Medical Science, Delhi. When I was in Delhi, we used to meet very frequently for many discussions in AIMS campus at that time, and she used to come to Karkaduma to our hospital also. I'm discussing about Dr. Arya Vaidya Sala Madam, discussing about Girija Madam. So she even told me she is actually a physicist. She is the head of department of NMR. But because of the respectful regards or association with Girija Madam, she also took a decision to learn Ayurveda. And she learned Ayurveda because of Girija Madam. That is a very great thing that I always remember. So just to briefly introduce Girija Madam, Dr. P.L.T. Girija, after the MPhil degree in sociology from Jawaharlal Nehru University, Delhi, graduated with BAMS degree from Venkataramana Ayurveda College, Chennai, one of the reputed institutions of the country. In her studies and in early practice, she was guided by some of the most distinguished Ayurveda Acharyas of Chennai. In 1990, she started Sanjeevani with a deep conviction that our ancient heritage of Ayurveda is the most efficacious of all the medical system and is capable of effectively meeting all the healthcare needs of the society. She has held position of honorary teacher in Ayurveda colleges in Chennai. An Ayurvedic practitioner for nearly 40 years, Dr. P.L.T. Girija, head of Sanjeevani Ayurveda Yoga Center, has been treating successfully large number of patients along purely Ayurvedic lines. She is a consultant to Healthcare System Development Project of Government of Tamil Nadu. She has been a consultant and trainer to Reproductive and Child Health Program of Indian System of Medicine of Government of Tamil Nadu. She has also been a consultant to Tamil Nadu government for mainstreaming of Ayurveda. She has authored a Tamil book titled Ayulai Valarkul Ayurvedam and has also contributed in many magazines, journals and newspapers on diverse topics in Ayurveda. She was conferred Best Doctor Award in December 2012 by Tamil Nadu MGR Medical University. Dr. Girija has been practicing Ayurveda under the name of Sanjeevani Ayurveda Yoga Center for the past 22 years. With a firm conviction about the efficacy of the applying Ayurveda only for all the chronic and acute cases, she heads a team of young Ayurveda physicians. She is consultant to Tamil Nadu government in Health System Development Project. She has trained around 2,500 village health nurses in maternal and child health using Ayurvedic practices. For the sake of that, she developed a kit containing 50 drugs consisting Ayurveda and Siddha medicines along with the manuals. Her strong voice against the use of episiotomy through the newsletters published by Sanjeevani Ayurveda Foundation reverberated in the Tamil Nadu public arena, and hence it is senseless use its senseless use is brought to a nil at the Institute of Public Health. An English book titled Jeevani Ayurveda for Women, authored by her, was released in 2030. She hopes to establish an Ayurvedic center which will be a home for all 8 limbs of Ashtanga Ayurveda. Madam, we are really lucky to have you here, and I humbly invite you to present your paper before this August Assembly. Thank you.
Thank you, sir. Now we invite Madam to present the topic.
I'm sorry, I had said a much shorter version of the biodata. I don't know from where he got this. My namaskaram to Dr. P.M. Warrior. Namaskaram to all the Vaidyas of this great institution, the teaching faculty, the medical students. At the time of COVID-19, they had no medical treatment. It was supposed to be a new disease. And 3 major institutions in India, ICMR, AIIMS New Delhi, and Postgraduate Institute Chandigarh, were at the helm of affairs. They were trying to manage COVID pandemic with no known line of treatment or medication. What started out as a mild and moderate jwara with associated symptoms, without any treatment, started quickly deteriorating into life-threatening condition, which caused the high mortality in India and elsewhere. India is very uniquely placed because we have our own medical system, Ayurveda. We have more than 4 lakh medical practitioners spread across the country. Even then, the central government and all state governments failed to explore or utilize the competence of and the efficacy of Ayurveda in treating COVID-19. Despite that, Vaidyas across India diagnosed and treated effectively a new disease and a pandemic. Now the situation in Tamil Nadu was somewhat like this. I belong to Chennai. Since we were not allowed to officially treat COVID-19, we started appealing to just about every possible official connected with the health department. Health department at that time was headed by an allopathic doctor, and we received no response from them. So we put together for clinical trial a protocol, and we met the Director of Medical Education with that. After spending a considerable amount of time, we managed to convince him that Ayurveda could be effective for COVID-19 patients. But the problem was he was willing to take only one single drug to test on COVID-19 patients. We were not here to test either the safety or efficacy. We already know the safety and efficacy of our medicine in any case. The second thing was he would use that single medicine in combination with half a dozen other allopathic medicines which they were using on COVID-19 patients at that point of time. Now we are for a standalone Ayurvedic treatment, and this was not acceptable to us, so we turned down his offer. Then there was a meeting at the State Planning Commission. The minister in charge was our patient. His entire family has been receiving treatment with us. I was the only Ayurvedic physician called, all the rest were Siddha medical practitioners. That meeting went on, it rambled along. At the end of it, it was felt that to treat COVID-19, you need life support system and ventilators. Now, it didn't come to any useful conclusion. Then we approached the Director of Indian Medicine. The Director of Indian Medicine, with our protocol, he did not respond. In the meantime, central government constituted a national task force. It consisted of scientists, Ayurveda Vaidyas, allopathic physicians, and I was part of two groups. One was a standalone Ayurveda group, another one, I don't recollect the name now. We spent considerable amount of time debating, especially the standalone Ayurveda group, submitted all the reports. That also, I suppose all the groups submitted their reports, but nothing came out of it. At the end of it, the only suggestion that was given, that 3 herbs, namely Yashtimadu, Yashtimadu, Guduchi and Ashwagandha, would be clinically tried for COVID-19, so it was of no consequence to COVID-19, frankly. Now we thought, okay, we could put up an appeal to the Prime Minister, so we wrote an appeal, and we thought quickly we get about 10,000 signatures from our patients. And as the numbers were nearing 10,000, overnight it vanished from the website, and it said that we had violated community guidelines. Now you can imagine the stiff resistance from all quarters managing public health system in India. By May 2020, patients started calling Ayurveda clinics, Siddha clinics, and even though we had no official consent to treat, we decided to treat. This data is based on 781 documented cases which were treated at our center. It was a standalone Ayurvedic treatment. We treated mild, moderate and severe cases, treated patients with multiple comorbidities and high-risk patients, and all patients treated were safe and it was effective. Now the following are the high-risk patients with poor outcome: diabetic mellitus, hypertension, cancer, coronary artery disease, chronic kidney disease, what is called CKD, chronic obstructive pulmonary disease called COPD, immune compromised state or a weak immune system, moderate to severe asthma, obesity which is above BMI 30, and all those patients who are above 60 years of age. The 780 patients, we had all the above mentioned high-risk patients. We had patients with multiple comorbidities. We had patients with low oxygen saturation. We had patients who are very young and very old. Very young was 1 year old, very old was 94 years old. Now, no matter what kind of protocol we may develop, unless and until you actually treat a COVID patient, you really cannot diagnose what COVID-19 was. Of course, we've been listening to many eminent Vaidyas talking about COVID-19. Many of them felt that, of course, all of them emphasized the agantu nature of the disease just because it was supposed to have been caused by a virus. Then some of the Vaidyas pointed out, because of the rapidity with which it worked, it could be compared to Visha. There were other Vaidyas who said it is a Sannipada Jwara. There were some other Vaidyas felt it is Sannipada Jwara with a Rakta Anubandha. So basically it could have been anybody's guess. The earliest known COVID patient was treated by us in either it was end of February or early March in 2020. This was a dedicated Ayurvedic patient. His entire family takes Ayurveda, and he was not in Chennai, and he came positive for RT-PCR, and he contacted us, and he locked himself in an office room. He had Sudarshan, Thalisa Patradi and Dhanvantra Gutika with him. He had all the symptoms of Vatakapha Jwaram, and he had moderate fever, 102. He had severe body pain, and he had all other symptoms that were seen. So after that, he was not a person with any comorbidity. He was a healthy person, so he got out of it, even with minimum medication. But after watching him very closely, we could clearly identify this as a Vata Kapha Jwaram. So if you look at the Ashtanga Hridayam, Tapahani, Aruchi, Parvashiroru, Peenasa, Shwasana, Kasa Vibandha, Shita Jadya Timira, Brahma, Tandra, Sleshma Vata Janita Jwaralingam. Charaka says, Shitako Gauravam Tandra, Staimithyam Barvanam Charuk, Shirograha Pratishyaya Kasa Sweda Apravartanam, Santapo Madhyavehacha. Vata Sleshma Jwaragrati. Madhyavehacha is very correct because among all the 780 odd, we would have treated much more than this. They were not documented because they were family, friends, neighbors, all that. So this is officially what came through the center. All of them, most of them, barring maybe 2-3 who went above 104 or 104.125 or 99% or even much more than that were between 100 and 102, plus minus 102. So this was the clearly a Vata Kapha Jwara, so the diagnosis was done. Now around the same time, the Ayush department, until then it did not allow the Ayurveda doctors to treat COVID-19, came up with what is called a case record form. Probably they came to know that people have already started treating. So they came up with a pretty good case record form. It's a large 10-page, like a booklet. Each had to have demographic information entered, chief complaints, travel history, contact history, date of onset, vital signs, comorbidities, medical history of the patient, Ayurvedic examination, provisional diagnosis and final diagnosis, assessment of the patient, presenting clinical symptoms, adverse events if any. Then there was a consent form. The consent form has to be signed by the patient. In our case, since we did not want the patient to come into direct contact with the treating doctors and our staff, we had requested that a person who is not in direct contact should visit us and sign on behalf of the patient. Thereafter, we would get on to the telephone and have a detailed conversation with the patient and enter all this. And every day we would start recording the daily progress of the patient. We had a treatment protocol like this. The criteria for inclusion and exclusion. Inclusion was all those who wanted to be treated with Ayurveda were included, but some had to be excluded because there are many patients who wanted Ayurvedic treatment along with allopathic treatment. Now, since ours was a standalone treatment, we could not include them. Then there were some patients who wanted to be hospitalized, and since it was under home quarantine, we could not admit them as well. So this treatment had to be under home quarantine with prescribed diet and medication. The patients for the first time had to self-monitor their conditions. Ayurvedic Vaidyas daily monitored the patients over telephone. They were assessed on several parameters: fever, appetite, body pain, urine and bowel movement, cough, breathlessness, general orientation, new symptoms if any, and signs of remission. They kept track of all the necessary vital parameters, sometimes multiple times a day, because the outside the newspapers were giving a very grim picture and the patients were extremely anxious. So we had to handhold them multiple times a day. They had to be spoken to, and all necessary parameters were entered, and resolution of symptom or a negative RT-PCR test, we followed them up. After post-COVID, they were prescribed Rasayana medicines and post-recovery medicines. Initially, we put together a basic kit that consisted of Barangyadi Kwati Churnam. Since we usually don't use ready-made kashayams, we only use Kwati Churnams, we continued using that. patients had to boil and take out the kashayam. And the next was Vyagrayadi Kvata Churnam, then Sudarshana Churnam tablets, Talisapatradi, Tiruphala Pippaliyadi Churnam. No, Pippaliyadi, no, Pippali. Tiruphala Pippali is from Sarangadhara Samhita. It's a very simple yoga. Haritiki, Amalaki, Vibhitaki, Pippali. And the Falasruti is also very simple, Shwasam, Kasam, Jwaram. So we retained that, and Dhanvantara Gutika was our basic kit. Of course, there was some standby also we kept initially. That was Tribhuvana Kirtirasa, which in Kerala it is known as Vettumaran Gutika. Swasakutaras, Dadimashtakam, maybe Kutajarishtam and Tippali Rasayanam, which is a Siddha medicine. So a few of this we had our basic kit and we started the treatment. The first wave was 337 patients we treated. The second wave we treated 322 patients, and the third wave 122 patients. The peak of second wave, the numbers of patients far exceeded our capacity, so we had to refer the patients to other Vaidyas. Now, actually, as I mentioned earlier, our first patient was not from Chennai. It was by a very eminent, very senior diabetologist known as Dr. C.V. Krishnaswamy. He called me and said, Girija, I am referring a COVID patient to you. I want her to be treated with Ayurveda. If I send her to an allopathic hospital, she will not survive the aggressive treatment. She has comorbidities and she is also allergic to many of the allopathic medication, including many of the antibiotics as well. So please treat her. We were initially very happy until we actually did the case. She was a 57-year-old female patient. She had type 2 diabetes mellitus since 1987. She was hypertensive since 1998. She had coronary artery disease from 2015. She had chronic kidney disease from 2013. She had obstructive pulmonary disease from 2014. She had a breast lesion from 2019. And she was maintained on hemodialysis, percutaneous catheterization of the internal jugular vein 3 times a week. Now you can imagine our short-lived happiness. Anyway, we had to treat. So I thought the best policy was go, okay, the other symptoms she presented with cough, fever, loose stools, nausea. A week prior to this, she had received allopathic treatment for cough and had completed a course of antibiotics but with no relief, and probably she had contracted COVID-19 a week prior to this. The best policy here is to go with minimum medication, because we cannot give one set of medicine which will bother. She has just about the entire list of comorbidities, and she is also on a 3 times a week hemodialysis, and so what are the least medicine we could give her? So we started with Sudarshana Churnam tablet, boiled and given in cooled water. Then the same Amlaki, Haritiki, Vibhitiki, Pippali, that is Tiruphala Pippali, Dhanvantara Gutika and Kottajarishtam. Even after 2 days, her fever persisted. That's when we introduced Bharangyadi Kashayam. And in 3 days after that, her fever touched normal. She had gotten rid of her body pain. She felt fresh. Cough was mild. Loose stools persisted, so we stopped the Tiruphala Pippali. She had completed 9 days of treatment. Now, the problem was like this. She had already missed 3 consecutive dialysis. And there was not a single hospital in Chennai which was willing to touch a COVID patient on dialysis, and that too on Ayurvedic treatment. Now, after trying 85 hospitals, on the 9th day, some of the routine tests what the hospital did, they found all the vital parameters as per modern Western medicine were normal. There was no lung involvement. CXR PA view was clear. Frankly, don't ask me what this CXR PA view was. Routine baseline investigation showed elevated renal parameters. But most importantly, The serum potassium and bicarbonate levels were maintained within normal range despite missing 3 consecutive dialysis procedures. On day 14, she underwent these procedures, and 14th day she was discharged from the hospital, and at that point of time her PCR test was negative. Then Dr. C.V. Krishnasamy called me at 10 o'clock in the night and gave me this news, and he said, this is possible only because of the protective nature of Ayurvedic medicine. And he wrote an article, no matter what the morbidity may be, we could take care of this Vata Kapha Jwaram. There were many other high-risk patients. I will read out that bit to you. Of course, this was a cancer patient of COVID-19. He had lung cancer. This again was contacted by the treating allopathic physician from Ramachandra Medical University, and he was on a palliative chemotherapy. He made an uneventful recovery. Then there was a female patient undergoing radiation therapy, post-mastectomy and chemotherapy. She was hypertensive for 10 years and had diabetes mellitus also for an equal number of years. She could resume her radiation therapy after getting cured of COVID-19 through Ayurveda. Now there were many patients who had low SpO2. Now this SpO2 is actually not our category because we would never go by SpO2. However, the patients would unfailingly inform you what their SpO2 was. So now a 65-year-old male patient with type 2 diabetes and anemia, with aortic valve sclerosis, with diastolic dysfunction, fatty liver, hypoproteinemia, had COVID-19. He had elevated CRP at 28, normal is said to be 5. The CT features suggested of acute viral interstitial pneumonitis with a lung involvement of 50 to 55%. Got Ayurvedic help after 9 days of allopathic treatment, which he did not tell us. Had he told us in the beginning that he had completed 9 days of allopathic treatment, we would have definitely not entertained him. Then, an 80-year-old COPD patient for 2 years he suffered from COPD, with an SpO2 of 76, made a good recovery. A 63-year-old female diabetic patient, she was also very obese, breathless, blood-streaked sputum, loose stools and fever with an SpO2 of 75, which according to her son dropped further below 70 when she had to go and walk to the restroom and come back. And in this case, a portable oxygen concentrator was being used, and it made not much improvement in her respiratory status, as it only improved the oxygen saturation by 2 points from 75 to 77. Now, Ayurvedic treatment for elderly with multiple comorbidities was also there. A wheelchair-bound 87-year-old female with a long history of chronic cardiac disease, who had recovered recently from a heart attack and who was also diabetic and hypertensive, made an uneventful recovery. A 92-year-old man who was hypertensive, undergone coronary artery bypass grafting of CAD with a history of TB and a recent burn injury, and he was put on a permanent urinary catheter and was treated safely with Ayurvedic intervention. And now there were, this high-risk patients, we wrote these cases in a journal article. You will get more details of these. Now there were many other patients. There was a patient who was in the ICU of a hospital in Chingalpet, and a cardiologist friend of ours contacted us and said, please send him some medicine. I said, how can we enter an ICU and treat? He said, that is none of your concern. Somehow they will smuggle it in, you send it. So we sent the medication, and I think I added to the basics some Tipili Rasayanam and some Swasguta Ras. And he came out of it, and he, with his entire clan, came to thank us. At that time he said something. He said, I was in the hospital ICU and I found no improvement, and I found I was steadily going down, and people surrounding my bed were all one by one passing away. And that is when I was given the first dose of Ayurvedic medicine. And with the very first dose of Ayurvedic medicine, I felt that I started feeling the difference. So this was his comment. Now, I gave you a set of patients whom we were treating. But if you frankly ask me what was the most difficult case that you faced, which doesn't actually come under the 781 cases, it was a family member of mine. He was in his 70s and he had contracted COVID-19. He was into the 4th week of COVID-19 when I came to know that he was in a very bad condition. I personally sat by the bedside and started treating. Now, his condition was like this. He had fever. His hands and feet had severe edema. He needed help. He was a healthy man, but he had reduced. He was almost bedridden. He needed help. And even a few steps to the bathroom, his pulse would rapidly go up to 140. And according to the treating allopathic physician, at this point of time, I could take on this patient much to the discomfort of the treating allopathic. And I could use just about every possible rasa drug that I could and to get him out of this situation. I had to use multiple weeks of these rasa drugs. I will give you the details of that. And at the back of my mind, I always had this doubt. These rasa drugs, they say, it can hurt your liver, your kidneys, and then you cannot use them long term, and then you're using it 2 to 3 times a day dosage. All this was also bothering me, but we were being handheld, consulted. We consulted an expert in Rasa Shastra from Bellary, and we are very grateful to him. And so I continued the treatment along with the Dashamulagadatriyadi Kashayam, which for a while I used and then I stopped. Then if you notice those low oxygen levels, there were a couple of patients whom I mentioned. When we treated them, we put together a set of medication and we used the muhurmuhu. So that also I used for him. So this I felt was the most difficult case, and it took us a long time to get him out of his critical condition. Now, among the, sorry, this is all going somewhere. Now the muhurmuhu, we called it lung powder because there are so many drugs, we didn't know how to name it, so we just called it lung powder. It consisted of Madhuyashti 50 grams, Sitafladi 50 grams, Sringabaswam 8 grams, Abragavaswam 8 grams, Shwasakutaras 25 tablets, Makarandwaja 10 tablets, Lagusutsekararas 40 tablets. Anupanam would be either Chaudram or Ghrutam depending on the avastha. Now, for the patient, I said I was using a lot of these medicine. Along with this, I used Jayamangal Ras, Hemagarbha Potali, Malagarbha Potali, all these medicine. And only one word of caution I would like to say, that we learned one thing, that our rasa drugs were safe. Only thing is, we need to rely on a reliable manufacturer which manufactures these rasa drugs well. Now, Hemagarbha Potali, the Falasruti is Kase, Shwase, Shaye, Vate, Kafe, Grahanika Gade, Sarvarogeshu Datavya, Hemagarbhakya Potali. And this we used, whatever we used, it was in the post-COVID condition, and this was a very useful medicine. But in this patient I mentioned, I used that. Now you look at Jayamangal Ras. I have not given the composition of Jayamangal Ras, this is only the Falasruti. Anupanam Prayoktavyam Jeerakam Madhu Samyatam. So we used to give it with Jeeraka Churnam and honey. Jeerna Jwaram Mahagoram, Chirakala Samudbhavam, Jwaram Ashtavidam Hanti, Sadhyam Asadhyam Atapiva, Pratak Dosham, Vividan Samastan, Vishamad Jwaran, मेदोगतं मांसगतं अस्ति मज्जागतं तथा अंतर्गतं महाघोरं बहिस्तांच विशेषतः नानाद उद्भवेषु चैव ज्वरं शुक्रगतं तथा निखिलं ज्वरं नामानां हन्ति. Any disease by the name of jwaram, it can deal with it, is Jayamangal Ras. Jayamangal Ras. And what is even interesting, the last line, Bala Pushtikaraschaiva Sarva Roga Nivarhanam. We cannot imagine a drug like this in any other system of medicine other than Ayurveda. Now some of the highlights of Ayurvedic treatment. There was no deterioration of patients under Ayurvedic treatment. There was quick resolution of symptom. Plus minus 6 was the resolution, including for those who are comorbid. Ayurvedic medicines were safe and effective. The entire treatment cost a minuscule when compared to the mainstream allopathic treatment, and very low mortality. In our 781 cases, there were 3 mortality. One of them was, the first mortality was an outstation patient. He was 78 years old, afflicted with COVID. After the medicine reached him, it reached him in the evening. He had 1 dose in the evening. Next morning, our routine calls start around 9 in the morning. By the time we called, he had passed away or passing away. They were rushing him to the hospital. At best, he would have got 1 more dose in the morning. Now, this is not a case that Ayurveda has treated, because we never had a chance to treat. But nevertheless, we had to enter it as a modality among our 781 cases. The second one was somebody, we had to treat him on compassionate grounds. He was an 88-year-old man, completely demented. His dementia, he could not communicate with doctors. No hospitals would admit him. He was a heart patient and diabetic. And in this condition, his son was nursing him at home. He was bedridden, and he begged us. He said, I understand that I cannot admit him in any hospital. Nobody is accepting him, and you please treat. It doesn't matter what the outcome is. So this was another patient who passed away. But the interesting thing in this is, among many patients and families who came to thank us or called us on the phone to express their gratitude, this son was one of them. He told us that while he was nursing his father, he kept taking the same medication as a preventive, and he never contracted COVID-19. The third fatality was an 85-year-old man. He was double vaccinated. He was a patient of COPD for 8 years, and he was having reduced kidney function, and he was a heart patient. He was already on a 5 milligram of steroid and paracetamol and whatever else. And he came to Ayurvedic treatment after 5 days when his condition was deteriorating. We had to accept him because he was known to one of the Vaidyas, a close friend's father. So this was the third fatality that we had. Now, the demographic details are like this. Among treated, 419 female patients, 362 male patients. Those with BMI above 30 was 118. Those above 60 was 184. Those with comorbidities, diabetes 124, hypertension 113, cancer 11, asthma 46, COPD 8, CKD 5, and on respiratory symptoms 594. So this was the demographic detail of this. Then 96% were symptomatic and 4% were asymptomatic. Patients with comorbidities, one single morbidity was 160 patients. 2 comorbidities were 58, 3 comorbidities were 18, and more than 3 comorbidities were 5 patients. These are the symptoms: weakness, fever, cough, sore throat, headache, diarrhea, nausea, vomiting, dyspnea, runny nose, confusion, etc. And recovery days, if you notice, including for those with comorbidities, it was plus minus 6. Age-wise comorbidities and risk factors. Age-wise recovery days was this. Younger generation got over it sooner than the older. Then retrospective analysis, we find Ayurvedic treatment for COVID-19 was safe and effective. It could handle mild, moderate and severe and high-risk patients with great efficacy. Mild ones received minimum medication, because I remember that 1-year-old child, we didn't give anything beyond Rajanyadi Churnam, and it arrested the progress of the disease. Severe cases received more intense care, effectively preventing deterioration of their condition. Case of hypoxemia, for them anything below 93 is hypoxemia, and for us we found that actually we didn't go by this, we would go by Shwasam. We would carefully watch whether the patient had Shwasam, and I found invariably the Shwasam sets in by around in the when the SpO2 level is around 70s. Whenever there is a severe cough and breathlessness, the medication and dosage became muhurmuhu. Once in 1.5 hours, roughly 10 doses between 7 a.m. and 10 p.m. Several cases of COVID received many rasa drugs with no adverse effect. Those with SpO2 in the 70s, according to Western medicine, if you see, were well into an acute and progressive stage of the disease, indicating severe pulmonary pathology. Severe case with pneumonia required hospitalization with intensive care and respiratory support. Despite poor diagnostic features, all those treated with Ayurvedic medication recovered fully. Now, no treatment or prophylaxis which could protect or prevent this disease with Western medicine from progressing from an early stage into a more serious condition. Zinc, vitamin C, antibiotics were of no relevance to COVID-19. Remdesivir and dexamethasone not mandated for mild and moderate cases. High use of steroid and blood thinners led to post-COVID complications. We had a number of post-COVID complications that came to us. And relying heavily on mechanical support system and self-limiting nature of the disease resulted in high rate of mortality. Now, these are some of the points we need to think of. The very first point I would like to say is the strength of a standalone Ayurvedic treatment. We often underestimate the strength of standalone Ayurveda treatment, and we find this is also because of the kind of inputs that is coming from modern medicine into our syllabus, where youngsters are trained more in allopathy than in Ayurveda. So we have lost the faith in a standalone Ayurvedic treatment. An equally important factor is there was no single universal medicine used in COVID-19. People in Maharashtra used a set of drugs. People in Gujarat used a different set of drugs. Tamil Nadu, we used a different set of medicine. Now, this is because, we only need to worry about what is the dosha. That is, as long as there is upachayam to vata kapha jwaram, we can use any medicine which is locally available, which we are familiar with. So there was no universal medicine for Ayurveda, that Ayurveda had a variety of medicines which was being used in COVID-19. There was quick resolution of symptoms among all patients, including those with comorbidities, at a very low cost, very low mortality, and Ayurveda was able to diagnose and treat a new disease with ease. And had Ayurveda been allowed to play a central role in COVID-19 pandemic, we could have avoided definitely a high mortality in this disease. Now, a lot of people were asking, how did Ayurveda diagnose a new disease? Now, I thought we could just recollect Vikaranam akushalo na jihriyat kadachana nahi sarva vikaranam namatosti drvastihi sayeva kupito doshaha samuttana visheshataha sthanandarani cha prapya vikaran kurute bahun tasmat vikara prakriti adhishtana antarani cha buddhva Hetu Visheshamscha Shigram Kuryad Upakramam. This is the methodology for us. This is a scientific methodology that is taught in our text, and we need to learn this, and our students need to learn this. And I think I would thank the organizers for giving me this opportunity to present this. Thank you very much.
Thank you so much, madam, for enlightening us with the detailed information on the topic. May I request Dr. Girija madam to please receive a memento from our Managing Trustee Dr. P.M. Vaidya sir as a token of our gratitude to you, madam. I request Dr. P.M. Vaidya sir to please present the memento to Girija madam.
Thank you, madam. Thank you, sir. Now it is time for the question answer session. We request the audience to share their queries, if you have any, so which will be addressed during the session.
Good evening, madam. It was a beautiful presentation. Thank you so much. So the question, you have told muhur lang powder. What is the reference, madam? Muhur lang powder. What is the reference? And also that Jayamangal dress. We have seen that slogan, but that reference has not been mentioned. That is one thing. And second thing, was there any complications during the treatment procedure? So. And what about the Pathya we have advised? These are the three main questions I would like to ask. Thank you so much.
Hello. Hemagarbha Potali and Jayamangal Ras, both of them you will find the reference in Vaishijya Ratnavali. Then, what else he asked? Huh? Lung powder, I gave you the combination. Pathyam, yes. Pathyam was the most important thing. We allowed nothing beyond moong dal, mudga, parboiled rice. You know, a lot of people in Chennai are used to raw rice, but we insisted they have to take purungalari. And the only spice used was dhania, jeera and pepper, and very little vegetable. So they are, and other instructions were they avoid sleeping during the day, keeping awake at night, no use of cold water, and these things were strict. We insisted they should follow very strictly, and some of our dropouts were because of this pathyam also. They said we can't handle this pathyam.
Any further questions, please?
After the COVID vaccine, any complications have you observed or people with? After the COVID vaccine, have you come across any kind of complications when we give? And that has to be treated with Ayurveda, anything like that? Can you just?
Frankly, doctor, although people came and told us I developed this after vaccine, we had no way of knowing whether it happened after COVID vaccine or not. Some of the doctors told me, because we have a number of allopathic doctors who know us and know our work and they interact with us. In fact, last week, the cardiologist friend of ours said that after COVID, he said COVID in general, he didn't say vaccine as such. There were a lot of cardiac cases. I know one patient of mine, she said soon after the COVID vaccine, she originally had a skin issue, a very bad issue, and after the treatment she was better, and she said it flared up in a very severe manner. But we had no way of clearly stating this is because of the vaccine. Anything is because of the vaccine. That I think we can wait and see. I'm sure these medical journals will themselves come up with some of these. Unless they suppress it, we really don't know. But post-COVID complication, we saw some, quite a few, who had a respiratory problem. Then people with who had become diabetic as a result of steroid-induced diabetes, and cases such as those, and under very severely compromised health. All that we did come across.
We hope there are no more questions.
Good evening, ma'am. As complications, sir said, after COVID, a lot of patients faced headache as a major post-COVID complication. So, compared to the normal people, the people suffering from migraine, the episodes has been increased in post-COVID complications. So, how to manage that and the solution for that?
You have such eminent Vaidyas sitting with you. I'm sure they'll give you the answer. Don't worry, you all have such fantastic doctors here. I think it should be treated as Shirorogam. And please, you're a student. Okay, RAV student.
Just because the episodes are more in post-COVID patients than the normal people having migraine, a known case of migraine. So if we treat the normal case of migraine, so the results are better in those patients. But comparatively, the episodes has increased in such patients of after COVID. So treatment-wise, how can we that?
No, you forget the COVID part. You treat the patient.
Okay, ma'am. Thank you.
Hello. Doctor, I have a question. You told me that, there was a case with multiple complications on hemodialysis. Is it so? So, you have not mentioned about the serum creatinine levels which is happening. And you told that, the hemodialysis was postponed. So, at that time, whether with the COVID itself, how is the renal parameters? Whether it is there is any deterioration at that time, and he has also diabetes, hypertension, etc. What about those? Did you monitor all these things?
We didn't. We didn't look at their blood pressure. These are not our categories. We just treated that patient with minimum medication. And I thought I mentioned that the routine baseline the test showed elevated renal parameters But the most essential things were under control. So nothing, that patient was very well, because she was on 3 times a week on hemodialysis, which she missed, but it didn't affect her.
So did you follow up?
Because we need not, only thing we instructed that she should be careful about the diabetic medication, which we told all the patients that, you see, they are used to a lot of food. They will take multiple times coffee, tea, then Thair Sadam, which is very popular in Chennai, curd rice. And curd rice, you know how much restriction we have on curd. And so suddenly you shrink the entire diet to just moong dal, parboiled rice and a few vegetables. So sugar levels would rapidly come down. No coffee was allowed, no tea was allowed, boiled and boiled water, small quantity. So we told them that you please make sure that your diabetic drugs are monitored so that it doesn't drop rapidly. So that was the only thing we gave.
So what is the logic behind your pathya? Because the pathya usually in this condition, it should be ama bhajana, no? Ama should not be there. That is what it says. But after the initial stage of jara, there may be the dhatu shosha will be there. So is it possible to do follow this pathya which you have mentioned?
This pathyam itself with dhania, jeera and pepper was doing the amapachanam. And the resolution of symptoms came within 6 days. So then we gave post-COVID rasayanam. Mostly we gave Agastya rasayanam and Dashamularishtam. These were the ones which we gave. So this Amavastha, Pakvavastha, Pachivanavastha, everything is sort of taken care of. As I said, COVID-19 was a mild or moderate jwaram. This level of mortality was only because there was no treatment, there was no medication. So a mild and moderate jwara, in the absence of any medication, rapidly started deteriorating and it went into mortality. I'm sure all of us have treated Vata Kapha jwaram in so many numbers. So this was this is an opportunity India missed by not making Ayurveda central to the treatment, because anyway they had no medication and mortality was very high. They were allowed to test any medicine without any scientific validation, whereas they stopped Ayurveda people from practicing. But in every state, I think people went to Ayurveda doctors. They couldn't care. And Ayurveda doctors also just went ahead and treated.
Thank you, ma'am. So we conclude the question and session here. Now we may invite Dr. Professor K. Murali sir, Chief Editor, Center for Textual Studies and Publications, to deliver the concluding remarks. Sir, please.
First of all, let me offer my humble pranams to Padma Bhushan P.K. Vaidya sir. Respected Managing Trustee Dr. P.M. Vaidya sir, Additional Chief Physician Dr. K. Muralidharan sir, our CEO and other dignitaries. So we had a very befitting commemoration to our P.K. Vaidya sir by organizing a technical session on active treatment of active COVID cases. Perhaps I think it was his P.K. Vaidya's last public health intervention was also on this COVID-19. He sent many messages through YouTube, etc. And he always was discussing with all the doctors on the management of COVID-19. And it was during this COVID-19 period we held our annual Ayurveda seminar on COVID, post-COVID syndrome, and the deliberations were published as a books. Also, we had a special issue of Arya Vaidya on COVID-19, which several single case studies were also published in that issue. So this is also an addition to our knowledge on management of COVID-19. So as a doctor with a sociology background, Dr. Sujata could treat so many cases, and nearly 781 cases were treated by her. And he used the principles of Jwara Chikitsa here. So in Ayurveda, we consider Jwara Chikitsa as a model for treatment of all the diseases. And the chapter on Jwara is put in all the Samhitas in the beginning of Chikitsasthana. So Jwara Prathana Roganam. Jwara is considered as most important among the diseases. And the treatment principles can be applied to in several diseases also. So many of the Vyadhyavasthas, all the clinical conditions are well manifested in Jwara. The Amavastha, Pakvavastha, Jirnavastha, Sharira, Manasa avasthas, the Dhadugada avasthas, Jirna Jwara avastha, Dina Jwara avastha, Sama Vishama Jwara avasthas. So all the clinical conditions which are prevalent in all the diseases are well manifested in Jwara also. So we consider the Jwara Chikitsa as a model for the treatment of all the diseases. We have several references also. In Raktapitta Chikitsa, Yeja Pitta Jware Proktaha, Kashayam Stamscha Yochayet. In Raktapitta, the medicines mentioned in Pitta Jwara can be applied. Similarly, in Visarpa also, Jwara Chikitsa can be applied. So that is why the Jwara Chikitsa is considered as a model treatment. And in COVID-19 also, this can be applied. Rogothanal prapakataha. Susrita specifically says that Rogothanat, in the beginning of all the diseases, Jwara can come up. Also in prapakataha, in fatality, Jwara is a symptom that shows the fatality or the end stage of, terminal stage of all the diseases also. So in this way, Jwara can be manifested in all the diseases in different clinical conditions. So Jwara Chikitsa can be applied in all the diseases also. Here, our resource person also highlighted the importance of dosha theory also. So diseases may come up, some of the prevalent diseases may disappear, some newer diseases may come up. This phenomenon is also very well narrated by Ganadhatsan in his Siddhanta Nidana. Adrishta drishta kaladi parinamat anekhata purana praviliyante navina pradurasate. Some of the diseases mentioned in the text may not be prevalent nowadays. Some of the newer diseases may come up. So then what should be our approach? It is with the dosha theory, we can interpret anuktamapi doshanam linger vyadhimupachare. Even though a particular disease is not mentioned in the text, we have to interpret it in terms of doshas and the treatment strategies for which are mentioned in doshopakramaniya and other diseases. With that we can manage all the diseases, even though we consider, so nothing is new to Ayurveda. So the concept of new disease is unknown to Ayurveda. Even the period of documentation of Samhitas, all the diseases are not at all documented, not at all mentioned in the text. Shakyam Naikaikasho Vaktam Adasamanya Muchate Ekaikashaha. It may not be possible to mention all the diseases with its Nidana Panchaga in the text. So, Adasamanya Muchate. What is documented in text are generalized strategies. So, by understanding this principle, we can manage all the diseases, and our resource person very well explained all these cases in a very convincing way. Bhargyadi Kashaya was mentioned by her. Actually, there are two Bhargyadi Kashayas mentioned in Sahasra Yoga. Bhargyabda Parpadaga Dhanya Vasha Vishwa, a very large Kashaya mentioned in Vishamadhyara Chikisa. Also, we have Bhargi Kana Kasahari Haridra, another Kashaya. I'm interested to know which combination we have used. Smaller one, Bhargi Kana Kasahari Haridra, which is mentioned in the Kasashwasa Chikitsa Prakarana of Sahasra Yoga. So similarly, Vyakhyadi Kashayam, Kabhavada Jwareshesha. So that was also one case experience authored by Dr. Ramesh was also with this Vyakhyadi Kashaya was also included in our Ayurvedic special issue on COVID. Another important point is the use of Rasaushadhas in COVID. So it is already mentioned, Kshipramarogyadayitval, Pheshajebhyo Adhiko Rasaha, Alpamatropayogitvál, Arujera Aprasangataha, Kshipramarogyadayitval. So it can be considered as an emergency medicine also in several cases. Some newer combinations which are already in the text but came into use during this period. So this Jayamangala Rasa and the lung powder, which is a newer combination of several herbal and mineral drugs, are also a very important contribution made by doctor. And I think his presentation was very enlightening and very convincing and very inspiring to all of us. And the strength of dosha theory was also highlighted by her. Tasmat vigara pragati radhishthanantaranica. Whatever may be the disease, with this Tasmat vigara prakritihi, the nature of the disease, adhishthanantaranica, the samprapti or the sthana samsraya of the disease, Bhuttva hetu visheshamscha, the specific causative factor of the disease. We have to interpret the emerging diseases also, and the armory of medicine in Ayurveda is very well enough, and this is very convincingly presented by Dr. Girija, and I thank you.
Thank you, sir. With this, we have come to the end of scientific session. Thank you all for your presence and participation extended to us in this evening. Thank you once again.